With other foods where we've genetically modified them, the genes replace the other genes. But with gluten or in wheat, they didn't actually replace them. So they have double the amount of genes. So there is that much more gluten in our bread now. So I have a lot of patients who went over to Europe for the summer and some, had a little pasta or whatever, but they sort of did okay because they haven't genetically modified their food in Europe. And so people can tolerate it. And so the wheat that we're eating today isn't the wheat that probably even our parents ate, and much less that our ancestors ate. I mean, it's been genetically modified a few times over. And then, I always get this question, oh, it's just a fad. Why is this such a big deal now? Well, it goes back to the gut, and I didn't really go over the whole what is a leaky gut, but I use that term all the time. And our gut sits together with these tight junctions, and we digest and absorb with our tiny villi. In a worst case scenario with celiac, those blunt down. But for most people, those don't blunt down. But what happens is we bombard it with foods we're sensitive to, medications, stress, age. These tight junctions break apart. And then larger particles slip through into our bloodstream, mostly gluten, casein from dairy, and it begins to stimulate our immune system. And over time, we develop an autoimmune disease. We develop a chronic disease. This was on the cover of Scientific America 4 years ago, giving the theory behind how is celiac, how is that autoimmune disease created. And so what I'm constantly trying to do is, with all my patients, is to heal this gut back up. And how do we do that? We look at the foods that they're sensitive to and get those out of their diet. We look at their gut and see what infections they have that maybe need to be treated. We look to see if they're missing some digestive enzymes or maybe need some stomach acid. Are they low in their good probiotics, their good bacteria? Do they need some L-glutamine, which is an amino acid that helps rejuvenate the lining of your gut? So really my whole focus is sealing up that gut and sealing up that leaky gut so that you have an intact immune system. You're no longer the foreigners coming in. So we live in a world where we're bombarded with stress, toxins, foods we're eating. Then we have this, super gluten molecule, and you put all that together, and then suddenly we have all these leaky guts, and now it's a big problem. It's not a fad. I mean, it's really not. The testing's gotten more sophisticated. Our gluten has changed over time. More people are having problems with it. So, my belief is that it's you're not missing any nutrients by giving it up. Yes, pasta's great. Pizza's delicious, all those kinds of things. There are other ways, if you eat other grains, there are other ways to have those foods. And you're not missing a nutrient if you give it up. I mean, there is no nutrient. I mean, that's always the thing when I hear these pediatricians, well, I'm not really sure, my pediatrician doesn't want me to do it. I'm thinking, well, just go back and ask them, what nutrient are they missing? Because I don't know of a nutrient in gluten or in wheat that, that is necessary or vital. So there's nothing that they're missing. In fact, they're likely doing themselves a world of good if you go back to the whole theory with the insulin and inflammation. When we're eating these pastas and pizzas, even if it's whole wheat, I mean, it's still getting refined down into a flour, which then makes it, more, less of a complex carbohydrate and more, stimulating of our insulin and